As a pediatric nurse, I know the start of life is vital for a baby's development and health. And one of the most important things a mother can do during pregnancy is to harvest colostrum, which is the first breast milk that is produced after birth. Before we get started, don't forget to like, subscribe, and turn notifications on so you don't miss out on any future videos. Colostrum is a thick, yellowish liquid that is produced in the last trimester of pregnancy. It's packed with antibodies, white blood cells, and other essential nutrients that can help protect your newborn from infections and illnesses. It's also high in energy, protein, and fat, making it easy for your newborn baby to digest. Colostrum is a type of early breast milk produced by the breast from around 20 weeks of pregnancy until the first few days after birth. It can actually leak from your breasts onto the nipples and cause yellow crust to form during pregnancy. Most healthcare providers say that it's safe to actually start collecting this colostrum around 37 weeks pregnant, but it's really important to check in with your trusted healthcare provider to make sure it's safe for you, because no two pregnancies are exactly alike. To collect colostrum by hand expression, which is the preferred method for harvesting colostrum, not a breast pump, make sure your hands are clean first. Then you're going to use your thumb and your forefinger to massage your breast in a circular motion. You're going to use them to massage it down towards the nipple. You're not going to actually pinch your nipple. That will not feel so good. You're going to actually just right above your areola and some of your areola and just gently squeeze, and that is hand expression, and move around in a circle to see which spots. You're going to drain the different ducts. And you're not going to have a ton coming out at first. That's why I suggest, again, using a medicine cup, which is what I talk about in my video all about hand expression. So you can get a little medicine cup from any package of infant's Tylenol, and you can just hand express into that. And it's just going to be a little bit at a time. And then once you express into that little medicine cup, you're going to draw it up with a syringe. I like a 5 milliliter syringe or a 10 milliliter syringe. And don't be discouraged if you only get 1 milliliter, 2 milliliters at first. This is so important, this colostrum, that even that little bit is going to be really great to have on hand for your baby. And then as soon as you're done harvesting it, you can put it right in the freezer. And a regular freezer, it's good for 6 months. And in a deep freezer, it's good for 12 months. When you're massaging your breast in that circular motion, that is going to help stimulate the release of the colostrum. And before you start, I have a little tip for you, which is to take a nice warm shower. And then as you're expressing, to help with your discomfort and to help get that colostrum out easier, you can use some heat packs. So warm compresses are great and they help get the milk flowing easier. So I highly recommend doing that as you collect this colostrum. Once your colostrum is collected, again, you can transfer it into a clean container and store it in the freezer. Colostrum is a precious substance that can help protect your newborn from infections and illnesses. By harvesting colostrum during pregnancy, you can ensure that your baby has access to this vital substance right from the start of life. Expressing colostrum in pregnancy has many benefits. It can help support successful breastfeeding after birth. Women who express colostrum are generally motivated to do all they can to increase their likelihood of exclusively breastfeeding their baby. Another benefit is that it helps build a supply of colostrum in the event that your baby needs any extra fluids or feeds, and can help avoid needing formula after birth. It can be used in situations like jaundice, low blood sugar, or blood sugar issues, or if you as the mother have diabetes or gestational diabetes. There have been some studies that show if you do have diabetes or gestational diabetes, it might be harder for your body to produce breast milk or take longer for your milk to come in. And harvesting this colostrum is really great because it can take some women days before their milk actually comes in. At first, you're just going to be having colostrum, but if your baby needs some extra fluids, you have that colostrum already harvested. And harvesting colostrum, when it's safe to do so in pregnancy, is not going to stop your body from making more. It actually can do the contrary. It can help your body start producing more colostrum and preparing the body for producing breast milk after birth. If you are a diabetic mother, there is the risk of having problems maintaining normal blood sugar levels, which can affect your milk supply and your production. Having that store of colostrum allows you to syringe in colostrum for feedings if your baby has any feeding problems. And your baby could have feeding problems related to premature birth or congenital conditions, tongue ties. There's many reasons why your baby might struggle with feedings or breastfeeding. So having this colostrum can be really helpful while you figure that all out. Maybe you want to involve a lactation consultant, see what resources are available to you at your hospital that you deliver at. And while you're getting through that and figuring that all out, having this freezer stash of colostrum that you harvested during pregnancy can really just give you such peace of mind and be super helpful. And if your baby requires any special care that might require them to be separated from you, again, this colostrum can be really helpful because you'll bring it with you to the hospital and you'll give it to the nurses so they can put it in a freezer and make them aware that you have it so that they can help you give it to your baby in the event that your baby needs it. Thanks so much for watching. Don't forget to subscribe for more tips and advice on all things pregnancy, breastfeeding, postpartum, and early childhood development. I'll see you in the next video.